Chapter 20, Radomski. So the chapter starts out with assumptions of OT and its ability to carry out one's roles based on the individual's capacities. So the three capacities that were mentioned in the book for physical activities are range of motion, strength, and endurance. And these are the building blocks upon which treatment for physical dysfunction is built. Overview of the musculoskeletal system. We have biomechanical aspects, and biomechanics is the study of motion by force, applying this to structure and function of the human body. And there are two types. There's static, which is non-moving, and dynamic, which is moving. And under dynamics, we have kinematics and kinetics. So dynamics is moving, and we're going to start off with the kinematic analysis. So this covers the location, direction of movement, the magnitude and velocity of motion, and the type of motion, whether this includes translatory, rotary, etc. So kinetics is the description of motion, and it's based on forces that cause motion. So you have internal versus external, and you also have slow reaction versus fast reaction. The physics of the musculoskeletal system. There's torque, which are the lever systems. Torque is force times distance, and torque is the tendency of a force to produce rotation about an axis. For example, lifting something is torque produced by biceps at the elbow. Torque also depends on the amount of force applied and resistance force, and the distance of force from the axis, which is the movement arm. So there's three lever systems, and the first class is when the axis of rotation lies between the effort and resistant forces. So the fulcrum is in the middle of the load and force, and it is balanced. The second lever system is when the resistance and force, they lie on the same side of the axis. So we have the load in the middle, the fulcrum on the left side, and then the force on the right. The third lever system is similar in that the resistance and force, they also lie on the same side of the axis, but the effort lies closer to the axis than does the resistance force. For example, if you bring a glass up to your mouth, that's an example of a third class lever. Next, we're going to talk about the basic elements of a muscle. First, there's sarcomere, which is made of actin and myosin, and is the main contractile portion of the skeletal muscle and is located in the myofibrils of the muscle. The nerve impulse is sent to the motor unit, motor neuron, axon, and muscle fibers to initiate a chemical reaction and release calcium, which prevents actin and myosin from combining, creating cross bridges. When these are broken, contraction occurs, and then also tension is generated. So the sarcomere is, again, it's made out of actin and myosin, and this is the main contractile portion, located in the myofibrils. The strength of contraction depends on the number and the type of muscle fibers found in a motor unit. So you have a large contraction or you have a small contraction. A large contraction includes large axons, large cell bodies, and many type 2 muscle fibers. So you're having a fast twitch. And the second type of contraction is a small contraction. And opposite of the large, it has small axons, small cell bodies, and fewer type 1 muscle fibers. So you're going to have prolonged activity and not easily fatigued. It also has to do with the number of motor units modulated for a certain movement. So small motor units, there's less tension and less energy, and it's usually recruited first. And then larger motor units will usually finish the action. So the types of muscle contraction, there is concentric, which includes a muscle shortening, and internal force of the muscle overcomes external resistance. The eccentric is when the muscle lengthens, and then the external force overcomes the muscle. And then the isometric, the muscle will stay the same. The muscle contracts, but it doesn't shorten, and the internal and external forces are in equilibrium. The biomechanical approach to treatment, there's 4 main types of treatment that were mentioned. This includes the maintaining, preventing limitation in range of motion, increasing the range of motion, strengthening, and increasing endurance. So the first biomechanical approach we're going to talk about is maintaining and preventing limitation in range of motion. Range of motion is the maximal distance that the bones move about a connecting joint and extensibility of connective tissues across the joint. So OTs are more concerned with functional range of motion, which is a range to perform daily activities. The factors that usually limit range of motion are systematic neurological, joint, or muscular diseases, surgical or traumatic insults, scarring, edema, and also internal and external factors. An example of internal is pain and inflammation, and examples of external factors are casting, splinting, and bed rest. Factors that limit muscle range of motion, there's changes in length and number of sarcomeres, the thickening of tissue, the loss of fibers, and atrophy. So here we have an example of how to decrease edema. Edema is something that can limit the range of motion, and edema is the accumulation of excessive fluid in intercellular spaces, and it's usually the natural result of trauma. If it persists over time, it can cause fibrosis and thickening of tissues and can limit a person's ability to engage in purposeful activity. So one of the ways to decrease edema depends on the stage of the injury, vascular status of the patient, and desired clinical effects. So over here we have elevation, cryotherapy, compression, massage, and electrical current. The first one, elevation, you're going to make sure that there's no arterial compromise, and to elevate to improve venous and lymphatic flow. The second one, cryotherapy, this reduces blood flow, slows metabolic activity, vasoconstriction, and decreases inflammatory response. And compression limits edema through external pressure. Compressive garments are usually used. And then you also have massage, usually a retrograde massage. You're going to massage from the distal portion of the extremity back proximally towards the heat. And also the electrical current. Although this may be useful, most therapists decide not to use it. Stretching is also a way to help with range of motion. And you also have active stretching and passive stretching. So stretch, it includes a target tissue that's lengthened by external force and eliminates tightness and produces change in extensibility of soft tissue. So factors that determine the effectiveness of stretching is duration, the time held under external force, the intensity, the speed, velocity, and the frequency. Active stretching, it includes slow repetitive isotonic contractions opposite of the contractures. It's based on activity analysis and is usually 3 to 10 seconds. Passive stretching is usually done by the OT. And again, this is an example of active stretching, and it's usually done by the client themselves. Passive stretching, this can include splint, cast, or done by the OT. Another step that we're going to talk about is strengthening. This is working against resistance to increase maximum force producing capacity of muscle and muscle groups. It's warranted only if the patient's strength prevents participation in occupation or may lead to a deformity. If weakness prohibits a person from maintaining a functional position or regular active range of motion, this may lead to contracture deformity. Strengthening is specific and is individualized, and it's affected by many factors such as age, medical condition, activity level, and therapeutic goals. So grading muscle strength parameters. There's intensity, which is the amount of resistance. You also have volume, which is the number of repetitions and sets. Also resting between exercises. Frequency of how much you're strengthening. and the type and velocity. This includes like dynamic versus static versus isometric. Velocity of training should match the velocity needed for occupation. And when a patient has hypertension or cardio problems, do not do isometric contraction. Increasing endurance. So factors that influence muscle endurance are motor units. Grading occupations to increase endurance in the patient and also increasing the number of intensity of things.